Understanding hazards identification in a hospital. Step 1. Understand the hospital environment and scope. Before you even start looking for hazard, you need to understand the hospital's context. Familiarizing yourself with the layout. Get a map of the hospital. Understand different department, ward, lab, pharmacy, kitchen, laundry, maintenance, administrative offices. Each area will have unique hazard. Understand the hospital's mission or services. What kind of patients do they serve? What specialized procedures do they perform? That is, a children's hospital will have different considerations than an oncology center. Identify key stakeholders. Who are the people you need to talk to? That is, departmental head, charge nurses, safety officers, maintenance staff, infection control team, biomedical engineer. Define your scope. Are you looking at the entire hospital or a specific department? For a newbie, starting with one or two departments might be more manageable. What is a hazard? In the context of health and safety, a hazard is anything that has the potential to cause harm, that is, injury, illness, property damage, or environmental damage. Why is hazard identification crucial in hospital? Healthcare environments present unique and diverse hazards due to vulnerable populations. Patients may have compromised immune systems, limited mobility, or cognitive impairments. Complex procedures, surgeries, medication administration, and diagnostic tests carry inherent risk. Biological agent, exposure to infectious diseases, chemicals, use of disinfectants, medications, and laboratory reagents. Physical demands, lifting patients long shifts. Psychological stressor, high pressure environment, emotional labor. Effective hazard identification allow healthcare organization to prevent harm and improve patient safety. Protect staff well-being and reduce occupational injuries or illness. Comply with regulations and standard. Improve efficiency to reduce cost associated with incidents. Common types of hazards in healthcare. Biological hazards, bacteria, viruses, fungi, parasite, that is, needle sticks, injuries, exposure to infection patients, laboratory spills. Chemical hazards, disinfectants, cleaning agents, medications, that is, chemotherapy drug, laboratory reagent, aesthetic gases, that is, spills, inhalation, skin contact. Physical hazards, slips, trips, fall, that is, wet floor, cluttered hallways, uneven surfaces, noise, radiation, that is, X-ray, MRI, extreme temperature, fire. Ergonomic hazards, repetitive task, awkward posture, heavy lifting, that is, patient transfer, prolonged computer use, pushing heavy equipment. Psychological hazards, workload, stress, bullying, violence, compassion, fatigue, shift work, that is, burnout, abs- ab- absenteeism, errors. Electrical hazards, faulty wiring, ungrounded equipment, overloaded circuits. Mechanical hazards, moving part of machinery, sharp objects, that is, surgical instruments, or broken glass. Fire and explosion hazards, flammable liquids, oxygen rich environments, faulty electrical equipment. Radiation hazards, ionizing radiation, X-ray, CT scan, radiation therapy, and non-ionizing radiation, MRI, laser, UV lamps. Security hazards, workplace violence, theft, unauthorized access. Step 2. Gather existing information, proactive method, review of policies, procedures, and guidelines. Hospitals already have a lot of safety documentations. Start by reviewing those to get a baseline understanding of known hazards and existing controls. Request access to documents. Ask the hospital's safety officers or relevant document head for safety manual and policies, that is fire safety, infection control, chemical handling. Standard operating procedures SOPs for key clinical and non-clinical tasks. Emergency preparedness plan, procedure, hazard assessment or risk registers, maintenance logs for critical equipments, material safety data sheets or safety data sheets for chemicals. Analyze the documents, look for hazard explicitly mentioned, procedures designed to mitigate specific risk, any gaps or areas where procedures might be unclear or missing. Step 3. Conduct systematic workplace inspection and walk through proactive method. This is where you physically go into the hospital area and observe, plan your route, use the hospital map, decide which area you will inspect thoroughly. Use checklist, develop or adapt checklist for different areas, that is a general ward checklist, a lab safety checklist. This ensures consistency and helps you remember what you look for. Physical hazards. Look for spills, cluttered hallways, block exists, poor lighting, damaged flooring, exposed chemical wear, unsecure equipments, fire extinguisher that are blocked or expires. Equipment safety. Check for proper labeling, maintenance, tags, sign of wear and tear, correct storage. Chemical storage. Are chemicals properly labeled, stored in compatible container and in well ventilated areas? Is PPAP available? Waste management. Observe how medical waste, sharp and general waste are handled and disposed of. Infection control. Look for hand hygiene station, proper use of PPE, clean surfaces, segregation of clean and dirty items. Ergonomics. Observe staff lifting patients, working at computer or performing repetitive tasks. Are ergonomic aid available? Observe work practices. Don't just look at static objects. Was how staff perform their duties. Are the following procedures? Are there shortcuts being taken? Take notes and photos. Document everything you observe, including specific locations, date and time, photos, with permission and respecting privacy. Can be very helpful. Step 4. Perform job hazard analysis. Task analysis, proactive method. This is a more focused approach for high risk tasks. Select a high risk task. Choose a task that is known to have a high potential for harm. That is administering chemotherapy, transferring a bariatric patients, handling blood sampling, sterilizing instruments. Break down the task. List every single step involved in performing that task. From start to finish, identify hazard for each step. For each step, ask, What could go wrong here? What could cause injury, illness, or damage? Example, lifting a patient step. Patient transfer from a bed to wheelchair. Hazard. Patient falls, stub back injury, equipment malfunctions. Document potential consequences. What could be the result if the hazard occurred? Identify existing controls. What measures are already in place to prevent the hazards? Are they effective? Involve staff. The best way to do a job hazard analysis is to observe someone performing the task and then discuss it with them. They know the potential challenges and potential pitfalls. Step 5, interview staff and seek feedback. Proactive method. Frontline staffs are often the best source of information about daily hazards. Conduct informal interview. Talk to nurses, doctors, technicians, cleaning staff, security, and administrative personnel. Ask open-ended questions. What are the biggest safety concerns in your area? Have you experienced any near misses recently? What equipment do you find difficult or unsafe to use? Are there any procedures that you feel are unsafe or could be improved? Do you have enough PPE for your task? Ensure anonymity if possible. Staff may be more willing to share concern if they feel their identity is protected. Use surveys for broader feedback. Anonymous staff surveys can be very effective. Step 6, consult experts. Proactive method. Don't hesitate to seek specialized knowledge. Identify internal experts, infection control nurses, biomedical engineer, facilities manager, fire safety officers, waste management personnel. Identify external experts. If the hospital doesn't have in-house expertise for a specific area, that is complex radiation safety, consider if external consultant might be needed for a comprehensive assessment. Discuss findings, share your preliminary observations, and ask for their insight on potential hazard and existing control. Step 7, analyze incident and near miss data. Reactive method. Learn from the past events to prevent future ones. Access incident report. Request access to the hospital's incident reporting system, that is for patient falls, medication error, staff injuries, equipment failures. Review and categorize. Look for trends. What type of incidents occur most frequently? Which department or shift have the most incidents? What equipment is most often involved in incidents? What are the root causes identified in investigations? Investigate near misses. These are gold mines of information. A near miss highlights a system vulnerability without actual harm, making it easier to address proactively. Focus on root causes. Don't just identify the immediate cause. Dig deeper to find the underlying systematic hazard. That is, patient fail is the incident. The hazard might be wet floor, poor lighting, inadequate staffing for transfer, or lack of fall risk assessment. Step 8, document and prioritize hazards. Once you have identified hazards, you need to organize them. Create a hazard register or log for each identified hazard record. Hazard description, that is slippery floor due to cleaning solutions. Location, that is word 3, hallway near nurse stations. Potential harm, that is slips, trips, or falls leading to fractures, head injury for patients and staff. Existing control, that is wet floor signs used. Severity of potential harm, that is high, medium, or low. Likelihood of occurrence, that is frequent, occasional, or rare. Risk level combines severity and likelihood to get risk rating, that is using a risk matrix. This helps in prioritization. Categorize hazards. Group them by type like biological, chemical, physical, ergonomic, psychological, etc. as listed in the canvas. Prioritize. Focus on hazard that pose the highest risk, high severity plus high likelihood first. Step 9, communicate findings. Hazard identification is useless if the findings aren't shared. Report to management, safety committee. Present your findings highlighting high priority hazards. Communicate to staff. Share relevant hazard with the staff in the affected areas. Explain why it's hazard and what existing control are in place. This builds awareness. Step 10, develop control measures beyond identification, but the next logical step. While your primary task is identification, you should think about control, hierarchy of control. When suggesting solutions, always aim for the highest level of control. Number 1, elimination. Physically remove the hazard, that is remove a tripping hazard. Substitution, replace the hazard, that is use a less toxic chemical. Number 3, engineering controls. Isolate people from the hazard, that is ventilation system, safety guard or machinery, patient lifts. Number 4, administrative control. Change the way people work, that is safe work procedures, training, rotation of tasks to reduce repetitive strain. Number 5, personal protective equipment, PPE. Protect the worker with PPE, that is glove, mask, gown. This is the last line of defense. Thank you very much.